Medical termination of pregnancy or MTP. Intentional or voluntary termination of pregnancy before full term is called MTP or induced abortion. 45 to 50 million MTPs are performed in a year all over the world. Many countries have not legalized MTP due to emotional, ethical, religious and social issues. Government of India legalized MTP in 1971 with some strict conditions. Importance of MTP. First one, to avoid unwanted pregnancies due to casual intercourse or failure of the contraceptive used during coitus or rapes. Second one, it is essential in cases where continuation of pregnancy could be harmful to the mother or to the fetus or both. MTPs are safe during the first trimester, that is up to 12 weeks of pregnancy. Second trimester abortions are very risky. Problems related with MTPs. First one, majority of the MTPs are performed illegally. Second one, misuse of amniocentesis. Amniocentesis is a fetal sex determination test based on the chromosomal pattern of fetal cells in the amniotic fluid. If the fetus is female, it is followed by MTP. Such practices are dangerous for the young mother and fetus. Sexually transmitted diseases or STDs. Diseases transmitted through sexual intercourse are called sexually transmitted diseases or STDs, or venereal diseases VD, or reproductive tract infections RTI. Example: gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and HIV leading to AIDS. Hepatitis B and HIV are also transmitted through the following ways. First one, by sharing of injection needles, surgical instruments, etc. Second one, by blood transfusion. Third one, from infected mother to fetus. Except hepatitis B, genital herpes and HIV, other diseases are completely curable if detected early and treated properly. Symptoms of sexually transmitted diseases. Early symptoms of STDs. They include itching, fluid discharge, slight pain, swellings, etc. in the genital region. Absence or less significant early symptoms and the social stigma deter the infected persons to consult a doctor. This leads to complications such as pelvic inflammatory diseases PID, abortions, stillbirths, ectopic pregnancies, infertility, or cancer of the reproductive tract. Prevention of STDs. First one, avoid sex with unknown partners or multiple partners. Always use condoms during coitus. In case of doubt, go to a qualified doctor and get complete treatment. All persons are vulnerable to STDs, though these are very high among persons in the age group of 15 to 24 years. Infertility. Infertility is the inability to conceive or produce children even after 2 years of unprotected sexual cohabitation. The reasons for this may be physical, congenital, diseases, drugs, immunological, or even psychological. These disorders can be treated in infertility clinics using assisted reproductive technologies or ART. Assisted reproductive technologies or ART is the technologies used to correct the infertility problems. Different methods of ART includes: first one, in vitro fertilization or IVF or test tube baby program. Second one, gamete intra-fallopian transfer or GIFT. Third one, intracytoplasmic sperm injection or ICSI. Fourth one, artificial insemination or AI technique. And fifth one, surrogacy. In vitro fertilization, gamete intra-fallopian transfer, intracytoplasmic sperm injection, artificial insemination, surrogacy. First method, in vitro fertilization. In this method, ova from the wife or donor and sperms from the husband or donor are collected and are induced to form zygote under simulated conditions in the laboratory. This is followed by embryo transfer or ET. ET is two types. First one, zygote intrafallopian transfer or ZIFT. Second one, intrauterine transfer or IUT. In case of zygote intrafallopian transfer or ZIFT, zygote or early embryos with up to 8 blastomeres are transferred into the fallopian tube. In intrauterine transfer or IUT, embryos with more than 8 blastomeres are transferred into the uterus. Embryos formed by in vivo fertilization, that is, fertilization within the female, is also used for such a transfer to assist those females who cannot conceive. Second method, gamete intrafallopian transfer or GIFT. It is the transfer of an ovum from a donor into the fallopian tube of another female who cannot produce ovum but can provide suitable environment for fertilization and development. Third method, intracytoplasmic sperm injection or ICSI. It is a laboratory procedure in which a single sperm from male partner is injected directly into an egg from female partner. Injection of single sperm into an egg from female partner. After the fertilization, the embryo is implanted into the woman's uterus. Artificial insemination or AI technique. Here, the semen collected from husband or a donor is artificially introduced into the vagina or the uterus of the female. Artificial insemination into the uterus is known as intrauterine insemination or IUI. This technique is useful for the male partner having inability to inseminate female or low sperm counts, etc. Fifth method, surrogacy. Here, a woman known as surrogate mother bears a child for a couple unable to produce children because the wife is infertile or unable to carry. the surrogate is impregnated through artificial insemination or implantation of an embryo produced by IVF. Problems of ART. It requires specialized professionals and expensive instrumentation. Therefore, these facilities are available only in very few centers. Also, it has emotional, religious, and social problems. Legal adoption is a good method for couples looking for parenthood.